All right, cool, cool, cool. Perfect. All right. Good morning once again. Appreciate y'all for joining this Zoom call, this diabetes workshop. We're pretty much going to talk about how to manage diabetes. Because just understanding from when I was younger, when I was kind of first introduced to, the disease of diabetes, I have family um, that's lived with diabetes. My earliest moment that I remember is one of my grandmothers on my mom's side. She actually passed away from a complication with diabetes. And that was kind of my first interaction of just seeing, how she was dealing with it and kind of how it changed her life. And I just didn't know what it was and how was it affecting her. And as I grown older, then I became a little bit more familiar, just knowing other family members that developed the disease. And honestly, just seeing what happened to my grandmother, like I was scared. Like when my dad developed it when I was it was close to like over 25 years ago. I was terrified. And now just being a little bit older and seeing my dad is still here and still thriving, there's a way you can still live with diabetes and live your best life essentially. And I know a lot of, some of the with social media, it's a great tool, and it's two sides to social media. There's a lot of great information, but then there's information that isn't so great. So I know there's talks about diabetes being type 2 diabetes being reversible. So we'll kind of talk about that today. Um, on the call with me that will be helping me out is Shemika Carter. Shemika, go ahead and introduce yourself and your expertise when it comes to diabetes.
Hey you guys, I'm Shemika Carter. I am a board certified adult and geriatric nurse practitioner. I am also a expert and on diabetes and obesity management. I have a purpose and a vision for helping people to live their best lives with the disease. We know that there are about 38 million Americans with diabetes, and 90% of that 38 million is type 2 diabetics, which is contributing to their lifestyle. The other 10% is that type 1 diabetes, and that's just, autoimmune deficiency. So I have a purpose to help people with type 2 diabetes live their best lives, like Kris said, with it. I have a clinic, True Care Telehealth and House Calls on Santa Rosalia Drive, and that's all we do is diabetes management. We do all things diabetes management and obesity management. Thank you so much, Kris. I'm Shemika.
Very nice. Thank you, Shamika. And we also have Ari. I've done some work with Ari already. We did something similar. We actually had an in-person workshop. I believe that was in May around mental health. And yes, go ahead and introduce yourself, Ari, and let us know how long you've been serving those with diabetes.
Thank you, Kris. Hi, everyone. My name is Ariadna Mednez. I am a registered dietitian, and I'm also a certified diabetes educator. I've been working with patients with diabetes for about 10 years. And just as you, Kris, my first interaction with the disease was my grandmother. She passed away from complications of diabetes. So that sparked my interest in getting to know more about, the disease, if there's a way to prevent it. I have a passion for prevention. Um, for people who have family history of diabetes, I like to help them prevent the disease, or if they already have it, I like to help them prevent those complications that come with uncontrolled diabetes, with lifestyle and diet, which is my specialty. And that's it. That's my passion.
Oh, thank you, Ari. Thank you. And then I introduce myself. My name is Kris Lawrie. I'm a personal trainer, fitness coach. Have a little bit of knowledge around nutrition as well. I've been training it'll be going on 8 years next year. I haven't quite worked with somebody long enough that was diabetic to kind of really see, changes. And when I say work with somebody long enough, I'm talking about at least a year, because I think a lot of the tools that are being pushed nowadays is more short term. So things could change short term, but how can we manage these things? How can we manage diabetes long term? We talked about lifestyle. Lifestyle was a word that's been mentioned since we started, and we're going to get into that, and also the medical as well, because there's a lot of tools that's being pushed like right away. So like I have a couple of clients that are pre-diabetic, and their doctors that they're seeing isn't necessarily teaching lifestyle right away. It's more so Ozempic, which we're going to talk about a little bit like right now, actually, because Shemika is going to start us off. We're going to talk about the medical tools that are out there. And yeah, so Shemika, I know you kind of covered the different types a little bit, but what is diabetes and how does it affect the body?
So simply put, diabetes is a chronic condition that affects how the body breaks down glucose, which is sugar, which is also our main energy source. It's just a disorder of the pancreas, right? So that's just a simple definition for everyone. What was your next question? I'm sorry, Kris.
Oh, well, I said, how does it affect the body? And I think you kind of hit it. Yeah.
It affects how our body breaks down glucose. It doesn't allow the insulin, which is a hormone, to usher the glucose into the cell to be used for energy. So sugar turns into glucose, carbs turn into glucose. Protein also stimulates insulin production. However, it doesn't stimulate as much as the carbs and the sugar. Simply put, once you eat carbs or sugar, it's turned into glucose, and the insulin is supposed to usher it into the cell, and it's supposed to be used for energy. That helps you to get up and go, work out, do everything that you have to do in life. Well, the system is broken. So it's not being ushered into the cell, it's just free floating in the bloodstream. And inside of the vessel, it's tearing, making small micro tears on the blood vessel wall, which throws everything off, all of our processes off. It messes up our microvascular system.
Okay, got you. So, are there any, like, if I'm not aware of if I have diabetes or not, is there any symptoms or anything I may experience that may kind of be like telltale signs that I might have diabetes?
Yeah, let me tell you 3 signs that I get all the time in the clinic, and people are asking, they don't know that it means that their blood sugar is way high, and they either have pre-diabetes or they have diabetes. Someone that comes in with blurred vision, they're like, my vision is just blurry and I don't know why. I always tell them, let's check your blood sugar. Someone that comes in, male or female, with persistent yeast infections. Remember, yeast lives on sugar. So persistent yeast infections, I'll tell them, let's check your blood sugar. Their blood sugar is probably running high. And last but not least, and one of the most popular, is numbness and tingling in the hands or feet. Someone that'll say, you know, my feet are numb all the time and they tingle. They feel like they're falling asleep all the time. I'll tell them, let's check your blood sugar. Your blood sugar is probably high. Those are like 3 symptoms that I get a lot, and people don't recognize that it means their blood sugar is high. So either they're insulin resistant, they're pre-diabetic, or they're diabetic.
Okay. So as far as like blood work, what should we be looking at? Like what ranges would mean I'm pre-diabetic, or if I'm in the diabetic range? What's a healthy range to be in, and what are the pre-diabetic and diabetic ranges as far as like the blood work?
So for me, there's 3 tests that I like to draw on a patient. One is the hemoglobin A1C. That's really popular. Everybody will tell you their hemoglobin A1C level. From 5.7 to 6.4, a level of 5.7 to 6.4 means you're pre-diabetic. Anything over 6.5 and above, you're already diabetic. There's no reversing it. Prediabetes and insulin resistance is 100% reversible. But once you become diabetic, some of those cells, they're called beta cells in the pancreas, there's already beta cell death. So it's not reversible, but you can manage it for the rest of your life. You could bring your hemoglobin A1C down, and that's just considered managing it. A lot of people, and on the internet, like you said, Kris, there's so much information, and they'll say, you know, you reversed your diabetes, but I guarantee you, if they start eating the way they were eating before, if they stop exercising, that hemoglobin A1C is going to shoot right back up. And that lets you know it's not reversed, it's actually managed. So you spend the rest of your life managing diabetes. Pre-diabetes and diabetes is, you know, pre-diabetes and insulin resistance is 100% reversible. The other thing is the glucose test. That's another test that I draw. The glucose, anything below 100 fasting without eating, it's normal. Anything above 100 to 120, you're probably pre-diabetic. Fasting. And fasting over 120, a glucose, means you're diabetic. We need to check your hemoglobin A1C, and it's probably over that 6.5 mark. And then the insulin levels are probably high. And that just means your pancreas is shooting out a lot of insulin, and it's shooting out more insulin because the insulin is not doing what it's supposed to do, which is to usher the glucose into the cell so it can be used for energy. And when it doesn't do that, then your pancreas in response will shoot out more insulin to try to force it to do that. Over the years, your pancreas get tired, like, well, nothing's happening. So it stopped shooting out enough insulin to usher the glucose into the cell, and that's diabetes. And remember, pre-diabetes, you have that up to 5 years before you become diabetic, and it's 100% reversible. Insulin resistance, 10 years. You have that up to 10 years before you become diabetic, and it's 100% reversible. Like you said, the doctor, your clients, the doctors are just throwing them on Ozempic and sending them away and not really teaching them lifestyle habits. Is one of the reasons there's 38 million diabetics in America, because we're not teaching them, we're not educating, we're just throwing them on medication and sending them about their way. And they're not changing their habits. They're using the medication to do what needs to be done, but they're not making no real lifestyle changes. And then the insulin level, like I said, that's the last test that I take, and it's probably high if you're on your way to becoming diabetic. But all these things, we can get on it. If we get on it right away and teach lifestyle changes and how to eat, like Ari does, send them to a nutritionist, get on it right away, we can prevent a diagnosis of diabetes. We're not doing that though. Our system is terribly broken.
I hear that, and I definitely agree. I definitely agree with that. Now, as far as like I mentioned, with my clients that are in the pre-diabetic range, like their doctors are trying to or putting them on Ozempic right away, and others semaglutides. What is a Ozempic, or what is GLP-1s? What are semaglutides, and how does it work, and how does that affect the body and help people manage their diabetes?
So semaglutide is a GLP-1. It's a naturally occurring hormone that our bodies make anyway, right? What they're giving us, the semaglutide, is a generic form of the naturally occurring hormone that our bodies already make. But when you get overweight, when you get pre-diabetic, your body slows down the process of making that GLP-1, that hormone. So your stomach is not holding on to the food long enough. So what GLP-1 does is a couple of things. It holds the food in your stomach to send signals to your brain to say, hold up, I'm full. So you don't have an appetite to eat anymore. And it slows down the process. That also it prevents the sugar from rushing to the bloodstream and being used for energy. Let's see, did I say that right? So it slows down the emptying process. You eat food and it sits in your stomach instead of emptying into your small intestines like it generally does. And it sends signals to your brain to say, I'm full, don't feed me no more. So the food is not being broke down and sent to your bloodstream. Sugar is not being sent to your bloodstream, and it gives insulin enough time to be produced in the pancreas and released, and it works. So the medication is actually doing all the work for them. And they tell you have to be on this medication forever. Who wants to be on medication forever? Instead of teaching them how to eat, how to exercise 150 minutes a week. Every week is all that's recommended to manage or prevent diseases, but no one's teaching them that. They're just throwing them on medication, like I said, those Ozempic, and sending them about their way. And because their hemoglobin A1C is going down, because they're losing weight, they're like, yay, I'm winning. But you got to get off the medication at one point or another. And once you get off, there's a rebound effect. Your weight shoots back up. Your metabolism is slow as a turtle because you haven't been eating like you're supposed to. And your hemoglobin A1C shoots back up, and people kind of are ushered into a diagnosis of diabetes because they're no longer on the medication. So it's a medication that they have to stay on. They have to give themselves this injection for the rest of their lives unless they use it for a tool like it should be used, and they're taught lifestyle changes, real lifestyle changes to manage instead of just relying solely on the shot. Did that make sense to you guys? Because I could say a lot about that.
Yeah, so if that makes sense, you could type in the chat. Type in the chat if that makes sense or not. I see a couple of questions. I know Dexter asked, "What are recommendations on proper diet and exercise regimens?" We're about to head into Ari's segment in 1 second, and Roxanne, kind of pretty much the same type of question. What can we do differently as far as continuing to manage our diabetes? So essentially, with the Ozempic, just based on what some of my clients say, how they're instructed to take it, I know they, start at a relatively low dose, and they kind of see how their body reacts with that for a little bit. I think maybe up to 6 weeks, and then depending on the weight loss or whatnot, if it's not high enough weight loss, or if it's not working like the doctor wanted to work, they'll up that dose. So I think they usually start at half a dose, then they'll go up another half a dose, so they're at one full dose. Then they'll go to 1.5, all the way up to 2, which is the kind of the max, just depending on how the person reacts to the medicine or whatnot. So yeah, so it can work, like Shemika says. It helps with dampening the appetite, so you're not going to be eating as much. So you're going to lose weight. However, I know, like Shemika said, that's probably not something people want to do for the rest of their lives, because if you don't really have an appetite, that means you can't really enjoy, some of the things that we connect with other people with. We connect with people through food. We just had Thanksgiving. Hope y'all had a great Thanksgiving. That means you can't really enjoy Thanksgiving like that. If you have kids or grandkids or family members, when it comes to birthdays, you really can't enjoy the food like that if you don't really have much of an appetite. So of course we want to, we want to control the diabetes, but I know we don't want to have to take the medication for a long period. So I guess this could segment into Ari's portion of the call. Before you start, Ari, can you explain the difference between a nutritionist and a dietitian? Because I think, just to us common folk, we may think they do the same thing, or it's like they have kind of the same knowledge around certain things. But can you explain the difference between the two?
Definitely. So, hi everyone again. My name is Ariadna Mednez, registered dietitian and certified diabetes educator. And so the difference between a dietitian and a nutritionist in the United States, the term nutritionist is not really regulated. You can take a 2-day online course and call yourself a nutritionist. So there's not really that much training required to be called nutritionist. A registered dietitian, on the other hand, we have to do a bachelor's degree in human nutrition, and we have to do a 9-month dietetic internship. We go do this internship in hospitals. We do go do this internship in schools, outpatient clinics. We have to, now it's the master's degree is required as well. And we have to pass the RD board exam. So that's the main difference. So as you can see, we have a lot more training than someone that would call themselves just a nutritionist.
Yeah, I like to interject with that, because technically I can call myself a nutritionist. I took I think 2 courses around nutrition. It was about 8 weeks. So technically I know I could call myself or introduce people myself as a nutritionist. However, when it comes to somebody that's diabetic, that's out of my scope. I can't really give them, or I can't prescribe a diet to somebody that's diabetic or have an eating disorder or whatnot, because once again, that is out of my scope, and I could get in trouble for that, and I don't want to get in trouble. But Ari, go ahead with your presentation.
Okay, and then I saw some questions on the chat, and I'm definitely going to cover those questions in this presentation, so bear with me. So my objective for this presentation is for you to understand, for people here to understand what's in their control, once you're diagnosed with diabetes, or if you have pre-diabetes or insulin resistance, because a lot of this is genetic. and also minorities, as we are more likely to get these medical conditions, these diseases. But there's some things that, so those things are not in your control, right? I'm Latina, I cannot, be something else, right? I'm Latina. Or I have family history of diabetes, that's in my genetics, right? I cannot do anything about that, but I can do something about my diet, my exercise, my stress management. If I already have diabetes and my doctor prescribed medications, I can be compliant with my medication. And those are the things that are in our control. So as you can see, we have a lot more things that are in our control than the ones that are not in our control. So we cannot just blame our genetics. So what is diabetes? So Shemika already explained what diabetes is very beautifully. Another way I like to explain it to my patients is with the broom and the potato analogy. So we all have a pancreas. We all have it. And that pancreas produces insulin. We all produce insulin. Insulin is a hormone that helps bring down our blood sugars when we eat. So I like to call the insulin that our pancreas produces broom that's going to sweep that sugar that's in our blood. So carbohydrates, I'm going to talk more about carbohydrates in a little bit, but carbohydrates are the ones that turn into sugar. So even if something is not sweet, for example, like a potato, a tortilla, or rice, they're not sweet, right? But when we eat them, our body turns it into sugar. That has to happen. Why? Because that's our cell's main source of energy. So let's say that, I eat a potato, I don't have diabetes, right? So I eat a potato, my body is gonna turn it into 30 small sugar cubes, right? Nothing to worry about, it's normal, it has to happen. But then since I don't have diabetes, my pancreas is gonna shoot 30 brooms to sweep those 30 sugar cubes. So those brooms are the insulin. So that happens in the body of someone that does not have diabetes. So what happens to someone that has diabetes? So that person is gonna eat the same potato, but their pancreas is only gonna shoot 15 brooms. So what's gonna happen to the other 15 sugar cubes? They're gonna stay in our blood. So that's how our blood sugars can come up really high. Or a lot of the times, the pancreas of the person who has diabetes is shooting that the right amount of insulin, but like Shemika has explained, there's insulin resistance. There's something preventing from your body from those little brooms to work how they're supposed to work. Okay. This is another visual. So these two are pancreas. The one on the left, it's a pancreas of a person who does not have diabetes. So the green dots represent the insulin. So it has a lot of insulins. It's producing enough insulin. So the pancreas on the right is from someone who maybe has family history of diabetes, and their pancreas are not going to be producing enough insulin. Okay, so what's in our control? Diet, like I said, diet, exercise, medication compliance, and stress management. So my specialty is diet. So I help people manage their diabetes with diet. So when I educate someone on diabetes, the three main the main thing that I like to explain to them and for them to make sure that understand are the three main food categories. So I call them food categories. We have the protein, we have the fat, and we have the carbohydrates. From these three categories, there's only one that's going to turn into sugar, and that's the carbohydrates. It's highlighted here. Now, something that I really, really want you to take away from this presentation is that carbohydrates are not evil, like social media wants us to believe. Carbohydrates are not bad. We all need them, but we have to understand about the adequate portion sizes for us based on our activity level or age or height, whether if we're male or female. We all have, the right portions of carbs that our body needs. And also the right carbohydrates, because not all carbohydrates are created equal. There's some carbohydrates that are healthier than others, that are going to spike our blood sugar less than others, and that are going to provide more nutrition than other carbohydrates. So it's the amount and the type of carbohydrate. So let's go over a little bit of the protein category. So what's a protein? So protein is the macronutrient that is going to help us it helps us with our hormones or muscle mass. It also helps us regulate blood sugar, because if we eat a carb by itself, carbohydrates are those foods that our bodies are gonna digest and absorb very quickly. But if we are adding a protein to that and some fat to it, our body is going to absorb it and is going to digest it much slower. So our blood sugars are going to spike less and slower than if you eat the carbohydrate by itself. So having protein at every meal and every snack is really important for everyone, but especially for someone who has diabetes or pre-diabetes or insulin resistance. So what's considered a protein? Every time I ask someone, when you hear the word protein, what's the first thing that comes to your head? And they always tell me red meat or any type of meat, right? Chicken, fish. And yes, those foods have a lot of protein, but we also, let's think of other sources of protein, like the plant-based. For example, here I have an example of edamame, which is soy. So soy products like tofu, tempeh, Greek yogurt, cheeses like cottage cheese, mozzarella cheese, eggs. Those foods also have provide us with protein as well. And what's a fat? So another misconception that I get with my patients is that, they tell me, I don't know why I have diabetes. I don't eat a lot of fat. Well, it's because fat doesn't turn into sugar. It's mainly the carbohydrates. Actually, eating the right amount and the right types of fat in your diet can help manage your diabetes. So those type of fats would be avocados, nuts and seeds, nut butters, oils like olive oil, things like, for example, butter and lard. Those things are not going to increase your blood sugars, but if you abuse them, if you overeat those type of fats, they can increase your cholesterol. So you have to be careful. You want to choose more of the healthy types of fat. And then we have the carbohydrate category. So this would be the group the category that's going to turn into sugar. Like I said, the amount is really important. And also the types of carbohydrate. For example, it's not the same thing eating fruit versus eating candy. Candy is not going to provide you with the fiber that you need. Fiber is really important because it also slows down your digestion. So you're not going to digest those carbs as fast. And so they're not going to spike your blood sugar as quickly than if you just eat the candy, right? So these foods will provide you with vitamins, minerals, and fiber. Fruits, beans and lentils, potatoes with the skin, whole grains, all of those are considered healthy carbohydrates. And then there's also a subcategory that would be the non-starchy vegetables. So technically, non-starchy vegetables fall under the carbohydrate category, but because they don't spike your blood sugar, they don't have a significant impact on your blood sugar. I give it to the patients like separately. And when it comes to non-starchy vegetables, the more the better, because they provide, again, the fiber, they provide vitamins, minerals, and a lot of antioxidants. So some examples of that would be squash, okra, leafy greens, bell peppers, carrots, cucumbers. Like all of these foods, I always tell the patients, just the more the better. Eat as many as you can. So now, there's many ways that a patient can go about portion control when it comes to their carbohydrates. For the purpose of time and for the purpose of today, I'm just going to cover what's called the My Plate method. So this is one of the first methods that I teach my patients how to use. So the My Plate method, basically what it tells us is the first guideline of the My Plate method is to try not to eat in plates that are too big, because studies show that the bigger the plate, the more we fill it up with portions. So a plate that's 9 inches in diameter, it's perfect for controlling your portions of food. Now, the second guideline of the My Plate method is that half of that plate needs to be composed of or from the non-starchy vegetable category. How you eat the vegetables does not matter. They can be cooked, they can be raw, they can be in soup, grilled, however you want to eat them, put some sauce in it, and then as long as you're eating a ton of them. So as long as the majority of your plate is those non-starchy vegetables that are going to provide the fiber for your blood sugars not to spike too fast or too much. And then on the other half of the plate, we want a quarter protein, and we want the other quarter to be a carbohydrate. So as you can see, we are including carbohydrates. We're just including them in small portions. And this amount of, let's say, mashed potato might look very, small for someone. So, this is the first strategy that I help the patients learn. But of course, everyone has different needs. Some people might need a little bit more, probably not less, but might need a little bit more. So it all depends on the person and their activity level. So this is one example. I work with a lot of Hispanic Latinos. So I always like to try for them to have that, still be able to eat their cultural foods, because cultural foods are healthy, can be healthy, if we eat the right portions and we balance our plate. So for example, this is like some protein. Half of the plate are some vegetables that Latinos like to eat often, like tomatoes, lettuce. We have a little bit of fat, which is the avocado. And then on the other quarter of the plate, we have a serving of beans, which is a healthy carbohydrate. It provides with a lot of nutrition, a lot of fiber, and we have that corn tortilla. Or they can skip the beans and have 2 corn tortillas. So it all depends on the person. Here's another example. Who likes enchiladas here? I love enchiladas. And so my patients love enchiladas too. So I try to help them incorporate them in their diet to control their diabetes. So here we have 2 enchiladas. What's the carb here? So the carb here would be the tortillas, right? So let's assume that inside the enchilada there's some type of meat. So that's the protein. On the other side, we have like a little salad with lettuce, tomato. We have a guacamole, which is the fat, and a little bit of sour cream. So this enchilada plate is balanced. So it has those vegetables, it has that protein, and we're not eating 6 enchiladas in one sitting, right? So we're just eating a little bit of them. Again, another example with pasta. A quarter of the plate, the other half would be the non-starchy vegetables, and we have the protein. So this is the My Plate method. Other carb counting sources that I'm not going to cover today, but that there's also available out there, is to use the fist to measure or carbohydrate. Let's say that we don't have a plate. If I have a size fist of rice or mashed potato or pasta, like that would be a good portion. Let's say for a female, maybe a fist and a half for a male. Also counting grams of sorry, this is a typo, of carbs by reading the label. So generally, I recommend 30 to 40 grams of carbs per meal for women, 3 meals a day, 45 to 60 grams per meal for men. But again, it all depends on the person and the lifestyle. And this method of counting the grams of carbs is a little bit more advanced. So I don't cover that unless the patient is familiar with the plate method, balancing their plates. I'm sure Kris is going to cover this, but exercise is going to open up the cell, and it's going to help your body use that sugar that you have in excess in your blood. So that's another tool that I teach my patients to use. Stress management is very, very important. We have a lot of stress here in the United States. And what happens is that our liver stores sugar. So every time we have excess stress, our liver is gonna pump that sugar into our bloodstream. A lot of the times my patients tell me, I don't know why my blood sugars are so high if I haven't ate anything. Well, one is because you have, maybe if you go a long period of time without eating, the liver is gonna pump that sugar. But also if you are stressed, which usually goes hand in hand, is gonna pump more sugar in your blood. Medication compliance, which Shemika already covered, is really important, because again, if you are that person that has the pancreas that doesn't produce that much insulin, you need a little help, either from insulin or other types of medication. So lastly, how to make goals. So sometimes my patients get overwhelmed with all of the information that I give them. So before they leave my office, I always have them set a goal, at least one or two goals that are realistic. We call them SMART goals. So it stands for specific, measurable, attainable, realistic, and time bound. So for example, if I set a goal of, I'm gonna lower my A1C, well, that's a really good long-term goal, right? But it's not really a SMART goal because it's not very specific. You're not saying what you're gonna do, what actions you're gonna take to be able to lower that A1C in the long term. So you wanna make sure that you set goals that are specific and that you can do every day, right? So one of my goals, for example, would be me, Ariadna, I will add at least one non-starchy vegetable at lunchtime in my work office. That's more specific because that I'm saying exactly what I'm gonna do, how often, and when, right? Another good example would be I'm going to take a 30-minute walk in the evenings after work, 5 days of the week. So that's more specific than just saying I'm gonna exercise more or I'm gonna eat healthier. If I say I'm gonna eat healthier, that's very broad, and eating healthy, everyone has their own definition of eating healthy, right? Some people starve themselves, some people do only juices, smoothies. So you have to be very specific with the lifestyle habits that you're gonna set for yourself. And yeah, that's my presentation. I know you're gonna ask me more questions. And I want the people who are in this meeting to set a goal, set a SMART goal. So look at the examples that I have here, and I want you to add in the chat a goal that you want to set for yourself that is specific. And then I can go over them, and I can go through a couple of them and see how specific they are.
Beautiful, beautiful. If you can, Ari, because I know a couple of us on this call may not be too tech savvy, if you could put your information in the chat, I know that'll be helpful as well. We do have a couple of questions. I know Dexter asked, what about dairy products? Is that bad for diabetes? Is that something that somebody that's diabetic should avoid? Or how can we work around dairy products?
That's a really good question. So if you're not lactose intolerant or allergic to the protein in milk, there's no need for you to avoid dairy products. You just want to count dairy products into your carbohydrate allowance. Let's say that you have a carbohydrate allowance of 45 grams per meal, right? So let's say one cup of milk would have about, I think it's close to 15 grams of carbohydrates. So you would just count that as your carbohydrate option. So if you're having that milk, cheese doesn't really have carbohydrates, so we don't count that, but things like yogurt or the milk will count as your carbohydrate allowance. So just make sure that if you're drinking milk or if you're having yogurt, to not add too many carbs in there. You make sure that you add a protein and you eat some type of fiber with it. But yeah, you don't need to avoid dairy products.
Very nice, very nice. And then I wanted to go back to the stress management. how does um how does stress affect hunger? Can you
Definitely.
answer that? Yeah.
Yeah, so things like because our hunger and our feeling full is controlled by hormones, leptin and ghrelin. So if your stomach is growling, it's ghrelin. If you're full, it's leptin. So what happens when you are stressed or you're not sleeping well, your body is going to increase cortisol production. So cortisol is a stress hormone, and that's also going to make your body produce more ghrelin, and more of those. Ghrelin is not the only hormone that's going to make you have that hunger or those cravings. There's many other hormones, but it's going to increase those hunger hormones. So studies show that on average, people who don't sleep well and who are like very stressed, they tend to eat about 300 calories more per day than people who sleep well and they're able to manage stress better. Because we all have stress, right? we all have stress in our lives, but the main difference is being able to manage it. So definitely it's going to make you eat more. And of course, if we eat more, we tend to grab, the chips, we tend to grab sweets, and that's going to increase your blood sugars too.
Good, good, good. Now, would you say cortisol bad, or what is, yeah,
It's
is that
not
a bad
bad.
thing?
It's not
Okay.
it's not bad. It's the hormone that is going to make us react, right? It's the hormone that is going to make us take action. But it's when it's too high for long periods of time, that's when it can become a problem. So stress management, go to therapy, do things that try to make time for things that you enjoy, so you can manage your stress better.
Perfect, perfect. And I have one more question. Is timing important as well? Because I know not just people with diabetes, but people that's trying to lose weight. I know they say, "Oh, I don't eat after 7," or they may adopt intermittent fasting. So would you say timing plays a part as well as when we're eating or when we intake carbohydrates?
So it depends. Intermittent fasting, for someone who does not have diabetes and for someone who just wants to lose weight, it can be a tool. So intermittent fasting is not magic. The way, because intermittent fasting is going to help you lose weight because it's going to put you in a calorie deficit. We need a small caloric deficit to be able to lose weight. So for a lot of people, the majority of their calories are coming when they come back from work. After 6, after 7, they're just watching TV and munching on those chips, or just mindlessly eating. And when they start applying the intermittent fasting, they're no longer doing that, so they're on a calorie deficit and lose weight. So that's the main reason why intermittent fasting works for weight loss. I don't really recommend intermittent fasting for diabetes, because like I explained right now with the liver leaking the sugar example, when we go long periods of time without, especially someone that has diabetes, long periods of time without eating, the liver is going to try to feed you, and it's going to pump that glucose in your blood. So we're not eating overnight, and on top of that, you're not eating breakfast or you're skipping dinner. So that's just gonna put more stress, on your body, and the liver is going to be pumping that sugar. I get this a lot in my office. Sometimes patient, I don't know why my blood sugars came out to 180 in the morning. I didn't eat dinner. Well, that's why, because you skip a meal, and your liver is trying to feed you, is pumping that sugar, but it's pumping more than what you need.
Perfect, perfect. Now I have one more question. Now as far as you mentioned calorie deficit. Um, I know just working with anybody, um, I just know generally we don't we underestimate how many calories we intake. So with your clients, do you have them track maybe for a short period of time just to have that awareness of, their calorie intake?
So again, it depends. It depends on what level my client came to my office. Because if my client came to my office not even familiar with the plate method, sometimes just applying the my plate method, they start losing weight because they're eating more vegetables. Vegetables are low in calories, and they're controlling their portions on the carbs and the protein. Sometimes in my office, we set a goal with a patient of switch soda for water and or like lemonade or like some iced teas made with no sugar. So that already is going to cut a ton of calories, and they're gonna lose weight, and they're not, there's no need for them to count calories. So it just depends on what level the person is, but I do get those instances where the person has a lot of knowledge on nutrition and they have lost weight in the past. And when I see that, and then they're ready, to do some tracking, we definitely apply that tool with them. Because, sometimes they could be those, we underestimate portions. They could be those sneaky calories in some like butter sauces, or they think, 1 tablespoon of peanut butter is much smaller than what people think. So we can definitely apply that tool with them too. I want to go over a couple of the goals that people put in the chat. So let's see. So let me choose one or two. So Shemika, she said, I will incorporate 150 minutes of physical activity per week every week. So that's a very specific goal because we're saying how many minutes and how often, which is per week. I think I would make it more specific by saying what type of exercise. Are you going to walk? Are you going to do some strength training? Are you going to ride your bike? Are you gonna do a combination? It could be more specific like that, but yeah, that's a really good goal. And it's going to help, let's say that, this person has diabetes, it's going to help lower that blood sugar. So it's relevant to what we're trying to achieve. Let's see. So Bernal is going to drink more water. So at least 4 of 8-ounce glass of water daily. Good. So that's a very specific goal because it's saying how many ounces, and how often, which is daily. So that's a really good goal. And drinking enough water can definitely help bring those blood sugars down too. That's another thing that I work with my patients with. And increase exercise 3 times a week. Oh, that's very specific, by cycling, walking, and aerobics. So good job. That's a very specific goal. Any more questions?
I think Vernell had that question. What happens when one eats and go to bed on a regular? So I guess eating close to bedtime. So eating and then going right to bed right after.
It depends on how much you ate and what you ate. We don't really recommend, eating a big meal and going to sleep right after, because that can it could just affect your digestion. You're not gonna be able to get that good night rest because your body is going to be very busy digesting that food. But let's say that you ate the calories throughout the day that you were supposed to, and you had a late night meal and you went to sleep right away. It's not gonna make you gain weight, because what makes us gain weight is having that calorie surplus every day or most days for that long period of time. So having a dinner that's late and you go to sleep right away is not just gonna magically make you gain weight. It all depends on your activity in the day, and then also your portions, what else you ate throughout the day, how many calories you ate. So there's no need to be worried about about that. If you have good digestion, at least when I eat too late and I go to sleep right after, like I pay for it because I don't sleep very well. But there's some people that do, so it all depends. But that's not going to magically make you gain weight just by itself.
And you said caloric surplus. Can you explain caloric deficit and caloric surplus?
Okay, so we all have different caloric needs for us to maintain a specific weight. Let's say that based on my height, my weight, my activity level, I need 2,100 calories to maintain my weight, right? So if I consistently eat an average of 2,100 calories weekly, I'm just going to maintain my weight, right? So a calorie deficit, it's let's say that I've been eating 1,800 calories. So that would be 300 calories that I'm not eating, right? That I need. So that's going to make me lose weight if I do that over a long period of time. So that's a calorie deficit. So that would be like 1,800 calories for me, right? But let's say that I start eating out more. I don't watch, my portions. So I eat an average of 2,500 calories a day. So that's a calorie surplus because it's more calories than what my body needs to maintain my physiology, to maintain my weight. So then I'm gonna be gaining weight if I do that often. So that's the difference between calorie deficit and calorie surplus. So calorie surplus is the calories than your body needs.
Got you. And we are in the holiday season, so I know usually it's a lot of people throw a lot of numbers out there as far as like, oh, this is the people gain 10 pounds during the holidays, and we gotta understand something. Thanksgiving is one day. Afterwards we may have the leftovers for a couple of days, and Christmas is one day, and we may have the leftovers for a couple of days, and then you got, the holiday parties and whatnot. So is it bad to have a surplus for a day?
No,
Ari?
no, like I said, in order for us to gain body fat, we need to be in a surplus for more than a day, for like a few days, and a few weeks to gain. And sometimes people weigh themselves after Thanksgiving and they see like a weight gain of 2-3 pounds, sometimes 5. But most of that weight is water because you cannot gain that much fat overnight. Most of that weight is water because when we eat higher sodium and higher carb meals than what we are used to, our body's gonna retain more water. So that's the main way the day after Thanksgiving. So that's why, I tell people, if you're on a weight loss journey, try to weigh yourself once a week, but like away from the weekend, not on Monday, not right after, because that can be impacted by what you ate on differently on the weekend. Even if you didn't have like a surplus, if you ate more sodium and more carbs than usual, your body's retaining more water that day.
Perfect. Thank you, Ari. Thank you for sharing that information. Hopefully it was something that the people could, just grab a nugget and start applying right away. So now I guess it's my turn. I see that Roxanne asked a question about the type of exercise somebody needs to do to manage their diabetes. And honestly, it's not going to be too much different than what I have somebody that's that doesn't have diabetes. First and foremost, I always say find something, because we want to be able to manage our diabetes long term. We just don't want to do it for short term. We want this to essentially be a lifestyle. So what is something that is sustainable? I think one exercise that's the most sustainable that pretty much everybody have access to, and doesn't need much equipment for is walking. We can all start with walking. And depending on your fitness level or your ability, the amount of time for walking is going to be different from person to person. But I think everybody could start off with walking, because, like I said, you don't need anything. You just need your body. Do what you can, and yeah, you can start off with that. Now, I made an Instagram video a while ago. It was from a lady named Dr. Gabrielle Lyons, and she kind of talked about how people shouldn't consider walking as exercise, which I kind of disagree. But the point she was kind of making was, um, I think a lot of people, when they do start off with their fitness, or if they have a relatively lower fitness level, that they'll start walking, and then that's probably the only thing they'll do. They'll kind of stop at walking. And I know she's more of an advocate for weight training. So through listening to her a little bit and kind of talking about, the trend of diabetes in our country, which is steady elevating, she made a point that I never heard before, as far as like diabetes and why it's so prevalent in our country. I think a lot of us think that diabetes may only affect those that are overweight or obese. So, we'll gravitate to Ozempic or a low calorie diet because we think, oh, if I lose this weight, then I could kind of get in control of my diabetes. And you can do that for a short term, because like I said, if you subscribe to a low calorie diet, it may be good for a couple of months or even a year, but being in such low calories, it starts to affect hormones. It starts to affect your energy. So that's not really sustainable. Another thing I see is, high intensity exercise. You have things like, you can say, there's something called the camp, the transformation camp. Anything high intensity. There was something called, what was the Insanity with Shanti. That's not the name of it, but it used to be a workout. But a lot of us start to subscribe to high intensity workouts, and that's not really sustainable. So going back to Dr. Gabrielle Lyons, she said it's not necessarily that people are overweight, but we're under muscled. And correct me if I'm wrong, Ari or Shemika, our body stores the glycogen or the glucose in different tissues. So it could be the liver. I've seen the brain as well, but also muscle stores glucose as glycogen. So it could use it as energy. And kind of just listening to that and how that example was explained so it could kind of be understanding is, the more muscle mass that you have, there's more room to store more glucose. So like the example that they said is like the muscle is a tank. So the more muscle you have, there's more room you can store. And I know, ladies, I know y'all worried about, well, I don't want to look like a bodybuilder. Look, just I know we have a couple of the examples up in here. Just lifting 3 times a week, you're not going to look like a bodybuilder because one, hormonally, you don't really have the profile to build muscle that quick. There's some outliers out there, but I promise you probably won't be that person. Um, and just the habits of a bodybuilder, it's not 3 times a week of working out. It's a lot more. So that's not really a shouldn't be a worry. Um, but yes, strength training. Strength training is important because like I mentioned, it can kind of give you a little bit more room to store more glucose. And then also, what I tell my clients, when we start to build muscle, we have a little bit more wiggle room with our diet. We don't have to be so strict. So if we have a little bit more muscle mass, we could go to Thanksgiving dinner. Of course, we want to be mindful of where we're eating and the portion sizes that we're eating, but we can enjoy Thanksgiving dinner. We have that little bit of wiggle room because we have the proper muscle mass and we have the proper habit of exercise to kind of, you could say, offset those things. We can enjoy the birthday parties, or if we have kids or grandkids or family members that have birthday parties, we can enjoy the birthday cake guilt free, and not have to worry about, oh, this is kind of bad for me and I need to go hard in the gym, or I need to go hard in the workout the next day to kind of burn off those calories. And I think just that way of thinking is, it can be dangerous because that could lead to other things like eating disorders. So yes, strength training. Like I said before, I think everybody should walk, but don't stop at walking. Add some strength training because there's a lot of benefits to strength training, not just um, the look. As far as I know, we want that tone look, um, the weight management aspects, but it could help manage our diabetes. Um, but of course, doing something that's sustainable. As far as like what your strength training should look like, I think for the most part, you should have a focus or more of an emphasis of doing more compound movements. When I say compound movements, you're more so working more than one muscle group at a time. So that'll be your squats, that could be your chest press, that could be your rows, that could be your shoulder press, things of that nature. If you're able to, doing some lunges. If lunges are a little bit challenging for you, just because of whatever the case may be, that could be step ups, things of that nature. Um, yes, strength training does help with pausal symptoms, menopause. So ladies, start touching the weights. And you don't, and when I say weights, like strength training, when I say strength training, actually working out in a way to build strength. So do not be afraid to, if you're at 5 pounds, don't be afraid to move it up to 10 pounds. Don't be afraid to move it up to 15 pounds. Yes, it may feel heavy, but as long as your form is correct, that's why I recommend working with a trainer. Um, Let me see. I gotta check my schedule to see if I'm accepting clients right now. So, but working with a trainer to help correct your form and whatnot, it could be beneficial. But yes, strength training, training to build strength, and not just training in a way to burn calories or training in a way to sweat. Let's kind of move away from that way of thinking. Um, Yeah, that's pretty much it. But I mean, as far as like the exercise and just in general, everything when it comes to eating, the exercise, and just the lifestyle habits, doing things that are sustainable. Sometimes, depending on the season, it's going to change up. So in one season, you could be locked in as far as like, oh, I'm like 100% on top of my diet. I'm 100% on top of my workouts. Like there could be a season for that, but that's just tough to maintain long term. Um, yeah. So that's pretty much it. Trying to think if there were any more questions. Um, I know Roxanne mentioned about how to get off Ozempic. So I think kind of just what Shemika, Ari, and myself kind of mentioned is really just adopting healthy habits and sustainable habits and changing your lifestyle. Because I think I don't know if we mentioned it up in here, but going back to Shemika, is there as a diabetic, if I'm on top of my eating, if I'm on top of my exercise, if I'm on top of my other lifestyle habits, stress management, and all that, can somebody that is diabetic maybe not reverse the diabetes, but is there a way I could live without medication, little to no medication?
Absolutely, 100% you can. This is where care coordination comes into effect. So the medical portion, myself, the nutrition portion, Ari, the exercise portion, Kris. If whenever someone goes to the doctor and they present with a diagnosis of pre-diabetic and the doctor or the nurse practitioner automatically coordinate care with a nutritionist, not nutritionist, a dietitian, a registered dietitian, an exercise physiologist, then the person probably would never even get a diagnosis of diabetes. Remember, pre-diabetes and insulin resistance is 100% reversible. Diabetes is not. So once you get a diagnosis of diabetes, you manage it for the rest of your life. And of course, you can bring your hemoglobin A1C down, but that's just by managing it. You didn't get rid of the disease. You don't have to get the disease if when you're diagnosed with pre-diabetes, hemoglobin A1C 5.7 to 6.4, we get on top of it, send you to a registered dietitian and send you to a exercise coach, then you never have to see a diagnosis of diabetes. So you can manage it without any medication whatsoever. And to answer Roxanne's question, how you get off of the Ozempic is you use it as a tool just to help you, but then you start incorporating the lifestyle. You have to change your lifestyle. And it's just that. It's not just for, and I'm not just saying you, Roxanne, like I'm just saying period to everyone. It's not just for a period of time. This is the way I have to be for the rest of my life. You have to get that in your mind. It's a mindset change, and you just have to live that way. You have to eat appropriately. You have to work out, exercise, move, walk, strength training for the rest of your life. You don't have to do it as intense, like 5-6 days a week, like you did when you started off, but you do have to do it at least 150 minutes a week for the rest of your life. You do have to eat, like Ari said, for the rest of your life. You have to incorporate these things, and you never have to put those chemicals in your body again if you commit to that.
Can I add to that?
Sure.
Go ahead.
So yeah, you explained it very beautifully again. And one of the things that I go over with my patients that have been on Ozempic, Wegovy, or any like weight loss medication as well is hunger management. Because a lot of the times people are, skipping meals, or they're not eating enough, or they skip breakfast, they're not eating enough for one meal, their meals are not balanced. So that's why it's important to go to dietitian, right? Because we go over all of those things that are contributing for your hunger to be out of control. And the Ozempic or the Wegovy are the tools that you're using right now to control that hunger, but you also need to be able to control it on your own without the medication. And those are the habits that we cover during sessions, definitely. And it takes time. We just don't go over it once. That's why, sometimes people tell me, oh, can you just give me a diet? Can you prescribe me a diet plan? And honestly, I wish it was as easy as that. It's, you don't want to rely on a piece of paper. You want to be able to make it a lifestyle, to make it habits. And in order for us to build those habits, it takes a long time. So you will need many sessions with the dietitian, with the trainer, with the doctor, because it takes time to learn those new habits.
And you hit it on the nail on the head with that. It takes time. So I think a lot of people that do, essentially, I think we all want to do things fast. However, doing things fast doesn't build sustainable habits. So really just focusing, like, I know it was probably a lot of information that was shared today. But I think the best way to kind of leave from this meeting or this workshop is to kind of focus on one or two things and implement it. Get good at that. And then start adding something else that we talked about. Add that one or two things. Get good at that. Just really essentially going brick by brick and not really just trying to build the whole wall at once, but brick by brick, trying to get better 1% each day, trying to get better at one habit over a month. That's how you build sustainable habits. But yeah, I think that is pretty much it. I know we just went over a little bit over an hour, which is perfect. We didn't want this to last too long, because we wanted to keep it simple and really just give information that you guys could really apply right away. So if you missed anything, don't worry about it. It is recorded, and it will be some information as far as like for the replays on YouTube with the chamber. I know Shemika is going to use the replay as well on her channel. Is there any more questions that anybody else had? We'll wait maybe for a minute or two. Can we have another session of these webinars? I think we could do that. I definitely want to do something like this, maybe quarterly, maybe around different topics. So if there's any other topics y'all would like to know about, either whether it comes from weight loss or also in person. Yes, originally we was going to try to do this in person, but just with a lot of things happening, we weren't able to do this in person. So most definitely we'll think about doing this in person. Cycling classes. I'm not certified for cycling classes, but I was thinking about getting that certification. But we'll talk about that. But does anybody have any more questions for Ari, Shemika, or myself? We'll wait a minute. Other than that, I would like to thank everybody that joined. Thank you, Shemika. Thank you, Ari, for sharing your expertise and your experience. Hopefully this was helpful for everybody and everybody was able to take notes. Shamika just posted her information for our YouTube channel right there. So y'all could grab that. Like I said, this will be replayed on, I believe, the Chamber's YouTube. So LA South Chamber of Commerce. So be on the lookout for that. Other than that, if there's no questions, that is it. I appreciate y'all for joining, and enjoy the rest of your holidays with your family and everything. And we'll see y'all later.
Thank
Thank
you.
you.
Thank you.
Great job.
Awesome.
Thank you.
Thank you.
Bye, guys. Have a great evening, morning, afternoon.
Somewhere else. Bye-bye.